Welcome to 519Connect, where the Windsor Police Service connects with members of our community. Let's talk. Let's have a conversation.
Welcome to this episode of 519Connect. I'm one of your hosts, Sergeant Drouillard with Windsor Police Service at our Community Service Branch. And today I'm joined by another member of the Community Service Branch. We have Surjeet Gill, and we have our special guest here. We have Leo Gill. So Leo is the project manager of the Windsor Essex Regional Community Safety and Wellbeing Plan at the City of Windsor. For over 7 years, Leo has worked in a variety of community development and engagement capacities, including outreach, group facilitation, research, data analysis, and project management. He often credits his work alongside residents as an outreach coordinator for the Glengarry and our West End neighborhood renewal strategies. As driving his passion for community work, Leo holds a master's in social work at the University of Windsor and has experience in working at all levels of social work practice. As a second-generation refugee, Leo's experience of humble beginnings living in Windsor's downtown core has shaped his belief in power of community and collaboration over adversity. Leo strives to support the voices of the community members and their visions for creating safe and thriving neighborhoods in Windsor, Essex. All right, Leo, thanks for joining us today.
Thank you for having me.
So just to get us started, can you tell us about a little bit of these humble beginnings that you started with, like what brought you to Windsor and the position that you hold right now?
Yeah, so well, really, my family came from El Salvador back in the 80s. At the time, there was a civil war, and so they had an opportunity here. My parents, it's interesting, they were highly educated over there in El Salvador. My father was a professor at the university there. My mother was a medical lab technologist, and coming here, there's a challenge. Sometimes your credentials aren't considered sufficient in Canada, and so there's a bit of a retraining process. That's what my mother had to do. So it felt like starting from square one. And for my father, at the time, immigration was really about connecting you to a job, any kind of job, not necessarily the one that fit your qualifications. And so starting off in factory work, it's a very different situation than being a professor of languages, right? Mm-hmm. And so so there was a bit of a challenge there. And the interesting thing is, outside looking in, definitely it was, I kind of laugh at this, but we were considered to be growing up in poverty, but we never felt that. We felt the sense of community, we felt the sense of love, and we felt the sense of, that if we are able to persevere and see that we have strengths inside of all of us, that could lead us to next steps. And so my father was actually doing a lot of work in the community, and I think I just kind of caught the bug and followed suit.
That's great. Yeah, so you've probably seen a lot of changes over the years in Windsor, growing up downtown to where we're at today, and some of the challenges that we're facing downtown, some of the positive changes that have taken place, and so it's great to have you here to kind of give us that experience there. But one of the main reasons that we're here is to talk about the new SNAPP program that we're working on together, and it's great to be meeting you working with Surjeet and talking about the SNAPP program. So can you tell us a little bit about the SNAPP program and what got started and how we got to where we're at now?
Absolutely. So I'll start off with a little bit of context that, and somehow it kind of happily enough matches with some of my work previously in the community. And so, so while I was working in community development in Glengarry and the West End, through those neighborhood renewals that you mentioned, we had an opportunity to work alongside the Windsor Essex Community Opioid and Substance Use Strategy. And through WECOS, that was really about seeing how obviously with the opioid epidemic and substance use on the rise, there was a need to look at different strategies to try to see how we could be supportive of individuals who are experiencing that, supportive of the community that's seeing the ramifications of addiction and substance use, but then also seeing how we may be able to intervene in a way that considers the community input as a key piece of the puzzle. And so how that started was we were able to kind of, as part of that WECOS enforcement and justice pillar, look to see how we may be able to look at Windsor Police as a key partner to have community resource officers deployed in different community areas where there were kind of a high propensity for substance use, and kind of the ramifications of that. Again, like you seeing used needles in areas and whatnot that would of course alarm residents, and start hopefully the healing process and the understanding process of considering how we can kind of work with individuals who are experiencing these challenges in a compassionate way. And so that started off that process, and so we were able to, by the end of my term there, before I went to the City of Windsor, right at the end there, we were able to kind of establish a partnership with Windsor Police to have resource officers in those given areas, and then actually Surjeet was one of those resource officers that were there, so this is kind of a culmination moment, I find. And so from there, I mean, obviously the pandemic hit, and new priorities, although of course the opioid epidemic and the substance use epidemics were top of mind. But you know, we were in a position of crisis response. We needed to deal with the pandemic and figure out ways on how to manage that. And so in many cases, I think the resource officers necessarily needed to deal with other fires that were going on. And now that during that time, I was writing the community safety and well-being plan. And so again, I don't know how these timings worked, but it happened to be that I was writing the community safety and well-being plan, which was a mandatory project through the province. And that led to an opportunity to really highlight the fact that mental health and substance use is a priority in the community. Engaged in safe communities is a priority in our communities. And we were able to revisit this opportunity. And so all that context leads to the SNAPP team. And the idea here, essentially, is, the full name is the Substance Supports in Neighborhoods Accessed through Police Partnerships. And the reason why we picked that name is it kind of hits it right on the nose of what we're doing. It's although the community safety and well-being plan is regional in scope, this needs to be neighborhood level. It needs to be focused in on those priority areas that really would benefit from having an individualized safety plan, would benefit from having additional public education campaigns, having officers kind of highly visible in the areas, and having partners available on a basis that's no longer just from a volunteer standpoint. And to clarify that, this funding really helps and allows resources to be provided to police, as also a key partner is the health unit, which is the backbone agency for the WECOS, so that we may be able to have dedicated resources and time to focus on these challenges. As you know, bringing community partners together, that takes effort, right? Planning takes effort, and if you're doing this on the side of your desk, which is kind of generally how many of these types of ad hoc kind of strategies kind of come to being, by no fault of the owner, we have to respond, but having that dedicated resource would really be able to free up some time and make it so that it's again top priority and it's being provided the resources appropriately. And then two other key aspects of that of the SNAPP team is really looking at training. So how we can have community level training, police training, to make it so that there's a better way to be understanding the challenges that these individuals are facing, looking at it from a compassionate lens, understanding the trauma that might be involved in that, and finally looking at it from a data perspective, seeing how we can track our success.
That's great. Because I've heard from the community, and like there's a lot of people out there that just don't want to just sit while all these things in the community are happening. These people that are facing mental health and drug addiction issues, they want to be involved. So when I'm talking to some of our community partners, they're looking and they're excited to get a part of the SNAPP program. So like we said in step 2 there. But Surjeet, if you could talk a little bit about, from a community service perspective, how we've already started to kind of be involved in getting set up for the SNAPP program, but also in continuing it.
Yeah, first of all, I'm going to mention that Leo's been vastly instrumental in designing all this whole grant through the Ministry of Solicitor General. We were able to get a 1.5 million grant, which is going to be planned through a course of 3 years. And again, it's a great partnership between Windsor Police, Windsor Essex County Health Unit, and City of Windsor, RC, Regional Community Safety Wellbeing Plan, which Leo is in charge. So I just want to touch base on this, that Leo mentioned about the WeCost, right? Windsor Essex Community Opioid Substance Strategy. The program was already running, and then we being from Windsor Police Service, we were part of those safety renewal neighborhood groups, which was funded by United Way, which sadly ended in March 2020. So 4 Windsor Police Community Services officers were assigned to different parts of City of Windsor, our West End, Fort City Neighborhood Renewal, Glengarry Neighborhood Renewal, and Downtown Windsor Community Collaborative. So what we were doing was, like, we were already kind of like doing what SNAPP project's going to build upon. Like, we were engaging with these communities and through implementing projects like SEPTED audits, neighborhood watches, and any other community events that were happening in the community. So we were already involved in that, right? So this SNAPP project's going to like build on that WeCost concept that we were already part of. So going forward, as Leo said, the way it's going to work is we're going to be more visible in the high priority areas. The biggest challenge is going to be approaching the people that are suffering from the substance use, right? The biggest challenge is going to be to build rapport with these people, and I think it's going to be huge and instrumental trying to get assistance from people who have lived experience, and so that we can reduce those barriers and try and get connected with these people. So that's how this project's going to unfold, hopefully sometime in fall. And then I'm very excited that I've been assigned as a coordinator from the Windsor Police Service to be part of this project, and I'm excited to be working with Leo and Windsor Essex County Health Unit going forward.
Hi, my name is Ed Armstrong. I'm the Inspector of Professional Advancement with the Windsor Police Service. With this position, I oversee our training branch, community services, as well as recruitment. As you know, Windsor is one of the most diverse communities in Canada. With that being said, our goal is to ensure that our police service represents our community. If you know anyone from your community that believes in our core values and will be an asset to our organization and serve the community with honor and service, the Windsor Police Service is currently accepting applications for the position of cadet. We encourage you to have them apply. Although patrol and ensuring the safety of our community is our #1 priority, the Windsor Police Service offers different departments that may interest you. To name a few, our Major Crimes Branch, our Forensic Identification Unit, Emergency Services Unit, and our Marine Unit. Which one interests you? So you want to know how to become a cadet? Simply visit our website at windsorpolice.ca under the Career tab, or visit oacpcertificate.ca. I'm sitting at my desk waiting to see your application.
Like you said, some of the challenges that I think we're going to face is, people that are suffering from mental health and drug addiction, when they see a police, sometimes at first they're a little bit standoffish, right? So that's why I think community service perspective and a lot of our other specialty units, our Coast unit, our MCERT unit, they have the luxury of a little bit more time than patrol officers sometimes in responding in those emergencies or very serious incidences where they can take time out to talk to these people and offer them assistance, right? So that's one of the challenges I see, but one of the ones that I feel that we're going to overcome very quickly. Like when they see us coming on positive, like just for no reason, we're just coming to say hi, coming over to meet them, introduce ourselves, things like that, and that already starts in reducing that barrier. But do you see any challenges for us?
No, absolutely. Absolutely. And I think that's the main piece of being able to connect it to the work of WeCost that has a number of community partners that are dedicated to doing client work directly with individuals, having that ability to incorporate those lived experiences and that lived that voice of lived experience. Because, quite frankly, you're right. I mean, one of the bigger hurdles will be just the barriers that are put in place because of stigma, right? Or because of, and that goes both ways. The sense of, perhaps police aren't here to help me, right? Perhaps they're here to move me to a different location or whatever it may be. But that previous experience could have, could be changed by future experiences and understandings that, we are looking at this from understanding mental health or understanding substance use specifically as a public health issue, right? And incorporating it as that. And again, those are monumental changes, I think, to be honest with you, in terms of the shift of how we approach some of these situations. Because if, I recognize myself, when it comes down to it, I by no means would call myself an expert in terms of working directly with individuals who have substance use challenges. But I know that there's a ton of great people that are working in that area. And that's the key part, connecting with those individuals, seeing how we might be able to improve efficiencies and ensure that when we're talking about intake or we're talking about referrals, that we're referring individuals to an area that's not going to lead to a dead end, right? That's not going to lead to a stop or a gap where an individual might fall through. And all of that involves partnership development, all of that involves planning, and that's why having dedicated resources from both Windsor Police, from the health unit, and also myself supporting, that'll help us try to reduce those gaps as much as possible. So that's really the way to kind of deal with some of those barriers, is understanding that we don't have the full experience on that, and that's okay, right? Mm-hmm. We should know when we don't have the experience and connect with those individuals that do.
Yeah, draw on our experts or the partners that we have in the initiative, right?
Exactly.
I think the other big thing too is, I don't want to call it keeping tabs, but like not just saying, okay, here's a resource for you and then let them go. We want to be able to keep that connection with them, right? To ensure that they stay on the right path, that they have all those resources available to them, opportunities maybe for housing or whatever, the supports for the drug addiction, the mental health addiction, maybe they're getting set up for the medical side of things, right? Mm-hmm. But just ensuring that we keep that connection with them so that they don't fall off the track that they're on, right, to success.
Absolutely, and I think that's another key reason why when we're looking at the WeCost kind of approach to understanding substance use and interventions that might be available and applicable, it's not a one-size-fits-all model, right? For some individuals, they may need harm reduction. For others, it may be more of an enforcement and justice approach, right? Because maybe we're seeing drug trafficking, and that's something that we would like to mobilize the appropriate resources to stop, right? But for others, maybe it's about looking at preventative measures, informing the public, having education. That's another piece. Education is making sure that the public is aware of who to call, when they're seeing a challenge or an individual that clearly is in need of support. Because I think sometimes, unfortunately, there's and naturally, this happens in every community across North America, there is a sense of this not in my backyard, this NIMBYism, right? That feels as though if we're seeing, an individual who may be homeless or an individual may be challenged by addiction or substance use, if it's out of sight, it could be out of mind. And so the action becomes, well, we want, Windsor Police to arrest these individuals and get them off the streets. But when it comes down to, is that the support that's actually needed? Is it going to be a revolving door, right? Maybe it's more about ensuring that there's the appropriate resources that are for that individual, and seeing that there's other opportunities. And that's why connecting people to the appropriate leads is so vitally important. And although many of the times that's occurring, sometimes you need to have that level of coordination that can help with making sure that, again, that we're not finding gaps, or that we're not missing individuals who might be needing of certain supports.
Mm-hmm. No, that's right. And like I've seen some social media advertisements and initiatives trying to get rid of that stigma, right? To try to humanize all these people that are suffering from mental health and drug addictions, and they have a lot of stories and things that they've gone through in life that got them to their point that they're in, right? So
Absolutely.
I think it's important to recognize that and to ensure that we deal with them in that sense, that they are victims and that they are suffering from but like you touched on there, and I've heard it before, and there's a tagline there that we can't arrest ourselves out of this issue that we're dealing with, right? So but there isn't just one solution. So I think that's why this SNAPP initiative is great, because it's all encompassing. It's trying to tackle it from a lot of different avenues, right, to ensure that it's successful.
Exactly, and it makes me think of also, so another project that I was working on through WeCost was the Label Me Person campaign, and that Positive Pathways is currently running, and they have an amazing team over there at Positive Pathways. I have to always give credit to Michael Brennan and his team over there. They're just fantastic. But one of the key pieces of that is exactly that we need to understand that these are people's parents, these are people's children, these are people's loved ones, that as we kind of just cast them away as something of using that terrible language of druggie or addict or whatever it may be, that we are completely dismissing the trauma that they may have experienced. We're dismissing the histories that they may have, the loved ones that are trying to be supportive, and again, that can be we look at that as understanding, if we can reduce that stigma, that might be a strength that helps individuals go down a different path, right? And in a path that that they're hoping to go down, because that's another piece is when you're dealing with trauma, sometimes you may not feel as though you're worthwhile, that you're worth that. And I know from, for instance, Bob Cameron at DWCC, Downtown Windsor Community Collaborative, and the REACT program. A big part of that is connecting people to other resources so that they feel that they're a part of something, that they are worthwhile, right? They're a part of the community. And again, that's not an idealistic thing. That's the way forward. That's 100% the way forward. And I feel that's something that sometimes needs a level of coordination, so that those individuals are put into those situations where they can feel that is an opportunity for them.
Mm-hmm. Yeah, no, we had Bob on this program, and we talked about the REACT program, and I think that's exactly what we were talking about here in growing the SNAPP initiative, is getting those community partners involved, but also in those community partners, they have people from the community there that are asking them, what can I do, right? Because I think for a while here, a lot of people just thought, there's just no solution to this. It's just, it just seems like it's such a huge undertaking to try to tackle this problem, right? And so, in a lot of that sense, people were just kind of dismissing it, right? Mm-hmm. But it's great to see this and the REACT program with Bob and things that are happening. Like it's good to get that message out there, right? Absolutely. That there's a lot of programs out there, there's a lot of initiatives out there that are trying to tackle this problem, right? And as a community, I think we can take it on, and we can come up with a good solution here.
Yeah, absolutely. I find, especially with the fact that, like, you're right, there's a sense of this feeling of sometimes hopelessness on situations that, these really big, complex social challenges, where it's like, well, where do we start? How do we even, move forward? What's the first step? And the reality is, there have been a lot of first steps already, right? There are existing organizations and existing work that it's about leveraging that, but also that, if we forget that the individuals at the heart of this, there are root causes that have led them down that path. And if we're not asking them, if we're not connecting with them, if they're not supporting, action towards what the next step would be, then what we're doing is we're solving a symptom of the challenge. We're not necessarily solving the actual challenge. And so that's, again, why it's so important to have that understanding and how that lived experience can really help with moving that forward, right?
We are early on in this initiative, right?
Yes.
So
yes.
It's funny kind of talking about it. Me and Surjeet were talking, like, it's funny doing a podcast, but we want to get that message out to the community that we are there are a lot of initiatives happening, right, that we're going to want to draw on them for as well to join us in this initiative, right?
Absolutely.
So, what do you see like coming in the fall then for like the SNAPP program and like getting together, getting these initiatives going, timelines? We're definitely excited to get started, right, and get going. We've got like some of the baby steps that are needed to get in place, but we're definitely excited to get going in the fall.
Yeah, I think one of the next steps is perhaps there will be another podcast where we'll have someone else next to us, which will be the coordinator on the health unit side. So we are, again, that funding allowed us to hire a direct position, which is amazing, right? Now you actually have that level of coordination on that end, that it's it's in their daily responsibilities to help with moving some of these pieces forward. And so again, that will be one of the first steps. And how we develop the team now, or now that we have our coordinator level, right? It's about making sure that we have the work plan, making sure that we have the partnerships in place, so that as we're executing into establishing this team in the priority areas that we are identifying, that we have a basis there of a bit of a procedure on how to approach it, but also recognizing that we need to be flexible, that each neighborhood will have a different need and will have a different priority, right? And again, recognizing very well that might mean also that we have different contributing parts or community members from that. And maybe we're incorporating businesses, maybe that we're incorporating residents involved in that solution finding process. And so again, that's where I'm hoping that with the fall, once we have that individual in place, we'll be able to kind of connect with the first priority area and kind of go from there.
Yeah, and I think even getting back to the beginning there when you were talking about your introduction and your humble beginnings here in Windsor as a young boy, yeah, I think that perspective, I feel, is going to give you a strong understanding of what we're facing and what newcomers are facing, and a lot of other our diverse community, right? We are a diverse community, so I feel like your background is really going to help with that for sure.
Yeah, thank you. I appreciate that. I think it's funny. I think when I think of our communities, I just maybe this sounds a little cheesy, but I just have this love for the downtown, for the West End, and to the extent I said this to my wife, if you say any street in the downtown or the West End, I know it. Anything in the East End, I have no idea, because that's not where I grew up, right? but I think when it comes down to it, that recognition that there are cultural differences in terms of from a neighborhood perspective, but also there's differences in terms of population, and it's important to recognize and celebrate that, because that could be a leading strength that can help with how you move something forward. Because once you have buy-in from a community, and that and I sincerely believe, buy-in from a community is when there's involvement from the community, there's input from the community, and it's reflected on, and it's considered in terms of the movement forward. Once you have that there, it's that hopelessness that we talked about beforehand, or that sense of fear of the next step, it gets a little less heavy, right? And it starts becoming a little more hopeful, and you start feeling as though you're not alone. Something that I always say too is, what I've seen in practice, some of the people that you feel are apathetic, right? That they don't really care. They're just like, nothing's ever going to change. All these, they're usually in my experience, they've been the ones that have wanted to see change, that have really pushed hard to see something change, or have been really frustrated when they don't see next steps happen, and that leads to that. So it's not that they don't care; it's that they cared so much, and they've been, they haven't seen the change. Once you start seeing those people come around, then you got some really good traction, right? And I think that's something that is incredibly motivating, and I think that's something that is what that next step will hopefully lead to.
Mm-hmm. No, I think that's a great way to end off here, in a positive note, in a hopeful note, that there is positive change already happening, but with our new initiative here, that we're going to get even more positive change together with the community and a lot of our community partners that we have involved. Is there a message for our community partners and the ones on how to get involved with the SNAPP program?
Believe me, we'll be reaching out quite a bit.
Yeah.
I personally, I really do sincerely believe, collaboration is key. It's important to make sure that we recognize the work that's being done, leveraging that, supporting that, and also seeing how that could lead to, again, the solution finding process. So in terms of that, I'm sure you'll be hearing from Surjeet and the new coordinator sometime soon, but we've already kind of started those conversations, and it's really helpful that we have a leg up because we are connected to the WECOS and the health unit, so they already have a number of great partnerships in play, and so it's just about making sure that we can leverage that as well.
We're looking forward to what the fall brings, the SNAPP initiative together. So thanks again for joining us today.
Perfect. Thank you for having me.
Surjeet?
Thank you for having me as well.
All right.
Looking forward to the fall and kickstart this great project.
Yeah. So there you have it, another episode of 519 Connect. We had Leo Gill here, we had Surjeet Gill talking about the SNAPP initiative, homelessness, drug addiction. Looking forward to this new initiative heading into the fall. But you can find us on all of our platforms, Apple Podcasts, Google, YouTube, Facebook, we're all over. So great episode, thanks again.
Thank you.
Thank you.